This lecture is about the locomotor system. I suggest we start with some basic anatomy and review the different healthcare professionals that deal with orthopedic problems. We will review some conditions of the locomotor system. We will then list the most common symptoms and focus on history taking. I will mention useful diagnostic tools and various treatment options. The musculoskeletal system, also known as the locomotor system, is made of the body's bones, muscles, cartilage, tendons, ligaments, joints, bursa, and other connective tissue. Injuries involving the musculoskeletal system are usually handled by a rheumatologist, a physiatrist, that is to say a specialist in physical medicine and rehabilitation, an orthopedic surgeon, a physiotherapist, an osteopath, or a chiropractor. Let's have a look at the most common symptoms. Let's name pain, stiffness, numbness, weakness, swelling or edema, bruising or ecchymosis. Now let's focus on back pain. Back pain affects 80% of the Western population. A GP expects 20 people per 1,000 on their list to consult with it each year, of whom 10% are referred to hospital. You should remember that the cause of back pain can be sinister. It can be due to cancer, cord or cauda equina compression, infection, etc., and needs to be taken seriously. As a rule, you should see backache as sinister if the patient is under 20 or over 55. When pain radiates to the buttock or leg, it might be due to sciatica. Pain associated with bladder or bowel dysfunction might be due to cauda equina compression. When pain is worse on walking with heaviness in one or both legs, that might be due to lumbar spinal stenosis. Now, let's review some diseases of the locomotor system. Arthritis. As we age, our joint tissues become less resilient to wear and tear and start to degenerate, leading to swelling, pain, and often loss of mobility. A more serious form of disease is called rheumatoid arthritis. The latter is an autoimmune disease wherein the body produces antibodies against joint tissues, causing chronic inflammation, resulting in severe joint damage, pain, and immobility. Osteoporosis is a condition in which the bones become thin, porous, and brittle due to low levels of estrogen, lack of calcium, and a lack of physical exercise. Osteomalacia is the softening of the bones caused by defective bone mineralization secondary to inadequate amounts of available phosphorus and calcium. Ankylosing spondylitis is a chronic inflammatory disease of the axial skeleton that can cause eventual fusion of the spine. Carpal tunnel syndrome is the commonest cause of hand pain at night due to compression of the median nerve. Lateral epicondylitis of the elbow or tennis elbow is the inflammation of the tendons of the extensor muscles in the hand, which are attached to the bone near the elbow. Muscular dystrophy is a group of inherited diseases in which the muscles that control movement progressively weaken. Dupuytren's contracture is a condition where the layer of connective tissue under the skin of the palm of the hand thickens and shrinks, which can cause the fingers to bend in to the palms. Myasthenia gravis is an autoimmune disease that involves production of antibodies that interfere with nerve-stimulating muscle contractions. Face and neck muscles are the most obviously affected, manifesting as drooping eyelids, double vision, difficulty swallowing, and general fatigue. Lupus erythematosus is an autoimmune disease wherein the body produces antibodies against a variety of organs, especially connective tissues of skin and joints. With our next slide, we will review the questions a doctor should ask when he suspects an orthopedic condition. A diagnosis in this particular field will be highly depending on whether the patient has had a trauma or not. To ask about trauma, your question might be, have you fallen? Have you been hit? Have you been in a car crash? Next, you will need to inquire about the place where the pain is. Can you show me where the pain is? The nature of the pain. Can you describe the pain? Exacerbating and relieving factors. Is it better if you lie down? Is it better if you walk? Radiation. Does it go anywhere else? The effects on a person's quality of life. Does it affect your daily life? Does it stop you from doing something? Does it stop you from sleeping? The risk factors. Are you diabetic? Do you stand a lot when you work? Do you remain seated for many hours? Do you smoke? Now, let's have a look at diagnostic tools. Among diagnostic tools used in orthopedic, let's name arthroscopy, wherein a fiber optic instrument is introduced into a joint cavity in order to visualize surfaces of bones entering a joint, find tears in internal joint structures, and evaluate sources of information. Isotope bone scan, wherein a radioactive element is introduced into the bloodstream. The distribution of the element is used to diagnose potential bone tumors, among other bone pathologies. Muscle biopsy consists in cutting out a small tissue sample of muscle in order to examine it under a microscope. This procedure can be useful in diagnosing muscular dystrophy and other neuromuscular disorders. Electromyography, wherein fine needles are introduced into muscles in order to make recordings of contractile activity. This procedure is useful in evaluating causes of paralysis, diagnosis diagnosing muscular dystrophy and other neuromuscular disorders. And obviously the usual X-rays, CT scan, ultrasound and MRI. With our next slide, we're going to review various treatment options. The treatment options may vary from making diet changes, taking medications, steroid injections, botulinum toxin, and incorporating exercise and physiotherapy in the daily routine to surgical procedures. We may use aids such as prosthesis, a collar, a corset, a sling, a splint, or a plaster of Paris if there is a fracture. Thank you for your attention.